I'm Dr. Nirav Shah, the new Chief Medical Officer of Doc.ai. I'm excited to speak with you today about why I joined Docai and what I think Docai holds for the future of health and healthcare in the United States. Our healthcare system is broken, and I believe that we are best poised to help transform it. Today, we waste 50 cents of every dollar spent on healthcare, and we don't get our money's worth. Americans don't live as long or healthy lives as our neighbors in much of Europe and other parts of the world, where in fact, we're also spending 5 to 10 times as much for a dysfunctional healthcare system in the US. Docai is going to help change that, and it involves the digital transformation of healthcare. We need to create the healthcare system we deserve, one that knows how to leverage all its digital, remote, and mobile, but is still personal, accessible, caring, and affordable.
I started out as an academic at NYU Medical Center as a professor on the faculty, teaching med students and residents, and caring for patients at the hospital. After a few years there and writing a lot of grants and papers and doing research, I moved on to be the Health Commissioner of New York State. And in that role, responsible for the health of 19 million New Yorkers and understanding how all the different pieces and parts of healthcare work together, I learned about the public health insurance system, Medicaid. I learned about the regulatory system, and I learned about how all the parts work together to deliver health to Americans. After 4 years in New York, I moved to Southern California, where I was the Chief Operating Officer for Kaiser Permanente in that region. And there, my roles included serving oversight over quality, over clinical operations, and the entire system from the Kaiser Permanente side of things. So ensuring 4.5 million Southern Californians, making sure that the insurance company worked with the clinicians, worked with the systems to really improve total health. This was a fantastic experience. So I'd spent time both in the private and public insurance spaces as a regulator, hospital operations. And so about 2 years ago, I moved to California, Northern California, where I joined Stanford University as a professor and started really focusing on the care models that will dramatically lower the cost of care. What can we do that will simultaneously improve quality and lower costs at scale?
By using the latest tools and technologies, including Edge, Zero Trust, and federated learning for artificial intelligence, Docai's study enrollment happens much faster, engages patients more, and collects data and creates knowledge that is actually relevant to the real-world experience of our patients. As our CEO, Sam Brouwer, likes to say, it's not about sharing data, it's about sharing learnings. And our platform allows you to customize to a patient's experience while preserving privacy, allows us to move from place-based care to virtual and remote care, and allows us to focus on real-world patient-centered outcomes.